Hello students, welcome back to another episode on the sqadia.com, and today what we are going to discuss is about drug distribution. So the drug distribution in pharmacology, it comes under the branch of pharmacokinetics, which in simple terms describes the transfer of a drug from one location to another. Once a drug enters into systemic circulation by absorption or direct administration, it must be distributed into interstitial and intracellular fluids. Now, intracellular fluid is the fluid that lies within the cells. In contrast, interstitial fluid is the fluid that present between blood vessels and cells. Now, each organ or tissue can receive different doses of the drug, and the drug can remain in the different organs or tissues. The distribution of a drug between tissues is dependent on various factors such as vascular permeability, regional blood flow, and cardiac output, perfusion rate of tissues, tissue binding, plasma protein binding of the drug, lipid solubility, and pH. These all factors we will discuss in further slides. The drug is first distributed in highly perfused organs such as liver, heart, and kidney. It is distributed in small quantities through less perfused tissues than like muscle, fat, and peripheral organs. The drug can be moved from the plasma to the tissue until the equilibrium is established. The concept of compartmentalization of an organism must be considered when discussing the drug's distribution. This concept is used in pharmacokinetic modeling. Now we will discuss the factors that affect drug distribution. Number first we have is physical volume of an organism. When you take a drug, it enters your body and interact with your tissues. The different types of tissues in your body have different preferences for the drug. So the drug may accumulate in different parts of your body in different concentrations. The chemical properties of the drug also influence where it accumulates. Some drugs may accumulate in the body fat, while others may accumulate in the fluids outside your cells, where the watery content is present, The volume of distribution of a drug is basically a measure of how widely it is distributed throughout your body. It is calculated based on the concentration of the drug in your blood plasma, and it takes into account the fact that the drug may accumulate in different parts of your body. So if a drug has a high volume of distribution, it means that it is distributed widely throughout your body, while a low volume of distribution means that it is more concentrated in your blood plasma and less widely distributed. Now, it can be determined from the formula, which is volume of distribution is equal to total amount of drug in the body over plasma concentration. It can also be used to devise the loading dose of a drug. The loading dose of a drug is basically the initial dose given to achieve a therapeutic concentration of the drug in the body. To calculate the loading dose, you need to know the volume of distribution, which is this, and desired plasma concentration. The formula to calculate the loading dose is equal to volume of distribution multiplied by desired plasma concentration. For example, let's say you want to administer a loading dose of a drug that has a volume of distribution of 50 liter and a desired plasma concentration of 10 milligram per liter. Now the loading dose would be, you will multiply both values, and 500 milligram is the answer you'll get. So this is basically important to know the loading dose and other various factors like the physical volume of the body of the individual where you want to introduce drug. Now the next we have is protein binding. Plasma protein binding is one of the important factors that can affect drug distribution in the body. When a drug is administered, it can bind to various proteins in the plasma such as albumins and globulins. Now, the extent of plasma protein binding can affect the amount of free drug available to distribute in the body, which shows no pharmacological effect in clearance. Now, the protein-bound drug will not show any pharmacological effect in clearance, while the free drug present in the bloodstream will show pharmacological effect and clearance. The extent of plasma protein binding can affect the amount of free drug available to distribute throughout the body. Typically, drugs that are highly bound to plasma proteins will have a smaller volume of distribution compared to the drugs with low plasma protein binding. This is because when a drug is bound to plasma protein, like this, it cannot easily penetrate cell membranes or diffuse across biological barriers like the blood-brain barrier. Moreover, drugs that are highly bound to the plasma proteins are also more likely to be displaced from the protein binding site by other substances such as other drugs or endogenous compounds. Now, this can increase the amount of free drug in the plasma, leading to, potentially higher concentrations in the body tissues. The binding between a drug and a plasma protein is rarely specific and is usually labile, which means reversible. The binding generally involves different bonds like ionic bonds, hydrogen bonds, van der Waals forces, covalent bonds. Now, these are the bonds between a drug and a protein. The degree of plasma protein binding can also influence drug interactions between multiple drugs. When two drugs are administered concurrently and both bind to the same plasma protein, they can compete for the binding site. It can lead to changes in the concentration of free drug and potential changes in the pharmacologic effect of drugs. Next we have is removal rate. Now, removal rate is one of the factors that can affect drug distribution in the body. Removal rate basically refers to the rate at which the drug is eliminated from the body, primarily through metabolism and excretion. When a drug is administered, it undergoes distribution to various tissues and organs throughout the body, depending on its physiochemical properties and the biological barriers it must cross. For example, if a drug is highly metabolized in the liver, may have a shorter half-life and be eliminated from the body more quickly than a drug that is not extensively metabolized. Now, this can affect the concentration of the drug in the plasma and the body tissues, as well as the duration of its therapeutic effect. Additionally, factors that affect removal rate, such as liver or kidney disease, can also impact drug distribution. In cases of liver or kidney dysfunction, the clearance of drugs from the body may be impaired, leading to potentially toxic levels of the drugs in the body. Other factors that can affect removal rate include drug interactions, genetic variability in the drug metabolism and elimination, and changes in organ function due to aging or disease. Now, the natural barriers can also resist the diffusion of drugs, similar to the obstacles encountered during drug absorption. One example that I would like to quote here is the blood-brain barrier, which hinders drug access to the brain by separating the cerebral blood vessels from the brain extracellular space, and the placental barrier, which safeguards the fetus by preventing high concentration of potentially harmful drugs from reaching it. Now, the next we have is redistribution of a drug. Now, redistribution is one of the factors that can affect drug distribution in the body. Redistribution refers to the movement of a drug from one tissue compartment to another after it has been distributed throughout the body. The extent and rate of drug redistribution depends on several factors, including the physiochemical properties of the drug, the biological barriers that it must cross, and the blood flow to various tissues and organs. Now, drugs that are highly lipophilic or have a high affinity for adipose tissues tend to undergo significant redistribution. Redistribution can lead to changes in pharmacokinetics and pharmacodynamics of a drug. For example, a drug that initially distributes itself to the from the blood to the central nervous system may undergo redistribution from the CNS, leading to a decrease in the concentration of the drug and potentially, altering its therapeutic effect. Additionally, redistribution can contribute to the termination of the drug's effect. For example, anesthesia drugs that undergo rapid redistribution from the CNS to other tissues, such as if you give thiopentone sodium when in the blood, first it will be distributed in the organs with the high blood flow like brain, kidney and liver. Then it will redistribute itself into the less vascular and bulky tissues like fat and muscle. and it will proceed to the termination of drug action. Now, redistribution can also contribute to drug interactions, as drugs that are co-administered may compete for binding sites in various tissues and organs, leading to changes in the pharmacokinetics and pharmacodynamics of both drugs.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.